And as Eric mentioned, I'm going to be speaking on intersex, bodily autonomy, and healthcare. And before I start, I've got some other gratitudes to extend that are going to sort of enlighten some underlying themes with what we're all talking about today. So I'm grateful to be here. Thank you, Intact Global, for giving me this purpose and a platform to talk about it. And I'm also incredibly thankful for the continued stewardship and legacy and wisdom from the tribes that are regional to this area. And I'm not attempting to outwoke anybody on this. It's genuine gratitude for the lessons and wisdom I have learned from Multnomah tribes, Wasco, Cowlitz, Cathlamet, Clackamas, Chinook, Tualatin, Kalapunya, Malala, and a lot more. And there is a lot of wisdom there. I'm also incredibly grateful and thankful for the labor and institutions for generations that came before me, including queer ancestors that have done the hard work of fighting civil rights. I am thankful for the sacrifice of women in years past who have been killed or persecuted for knowing more than they should about healthcare and practicing healthcare in general. And then especially how we're all here as a country built on the backs of slavery and institutionalized, commodification of people's bodies. So these are, we've got Black people in slavery, indigenous genocide, and burning witches. What does this all have in common with circumcision? Colonization. It's the other C word. Yeah, circumcision, in my opinion, is a form of bodily colonization and sexual colonization. And we've talked about queer repression, we've talked about cultural repression in a lot of ways and how it's manifested in this quote unquote healthcare practice. And I really appreciate Aliana being here and representing Intersex fam, what up? Because, part of that colonization is being fed the fear that you are alone in this fight. And so that's what's so inspiring about being here right now, is to talk about healthcare and what it means to us as a community moving forward. So with that, I'll actually start the presentation. Here's what we're gonna be talking about in this presentation. Why IGM, intersex genital mutilation, occurs, and just a little bit of a content warning. There's no graphic photos or images, but we are going to be talking about medical abuse in medical settings. And you guys are probably all really used to that by now. And then how coalitions and movements supporting bodily autonomy can support one another moving forward. So kind of a problem-solution format moving forward. And you'll hear some comments that are probably going to be redundant to what some other speakers have said today, and that's okay, because I'm here to reinforce everything that everybody's saying here. Because we're all on the same team. All right. Okay, cool. So I will be using my lived experience and my experiences as an intersex person to talk to you guys all today. That's important to introduce myself as a speaker and say I am not here as an expert on an intersex experience or anybody else's sexual experience, because as we all know, communities of people aren't monoliths, we're not stereotypes. So I will be speaking from my lived experience as an intersex person and a survivor of IGM. And I'm also here to use my personal insights to help inform us as a community how to move forward with the information and trauma-informed approach and strategies that have been helpful to me in understanding what has happened and what is happening, and then also that has what has brought progress. And from whatever good it will do you, I can also share with you the resources and information that I have found to be helpful to me in discovering my identity and discovering communities and people to talk to that have broadened my perspective. So, a little bit about me. Born fabulous, my name is Carrie Cantrell, and there's me in the blue and in the pink and in the center there on my way to get christened at St. Paul's Episcopalian Church in 1989 in Connecticut. I'm going to talk a little bit about my family background, just because demographics are important when we're talking about who's targeted for this type of coercive pressure in medical settings. My mom is a UConn graduate, go Huskies, and my father was an auto dealer, both with middle-class backgrounds, both with like split families or trauma in their family domestic life, and both, struggling to cross class barriers at the same time while having children and raising children. I'm my mom's second kid, and she was barely 23, so she had barely graduated college when she was having me. And so when I was born, I got the dreaded, ambiguous sort of call on the doctor and spent 2 weeks under observation after being transferred from a community hospital to Hartford Medical Center. And Hartford Medical Center established that I was born with XY karyotypes, and the genitalia I was born with would be non-functional in heteronormative sexual adult relationships. That wasn't a problem for me at the time because I was a newborn, obviously. No interessante, thank you. But I also, want to share the parts of my intersex story. And so, born in 1988, and in April 1989, 8 months old, I was baptized, and I went home with a birth certificate that declared I was a female. I was assigned female at birth. And my parents were on the birth certificate, even said where my dad worked. It's very specific. He was working at a car dealership in Connecticut somewhere. And in 1990, 18 months old, is when I was actually taken out of state and taken down to Duke Medical Center, which is where the IgM occurred. And this was after a full year and a half, almost 2 years of living healthfully, naturally, as I was born. And the reasons for the surgery that were listed were cosmetic, essentially. Cosmetic. They had had several conversations with my parents after Hartford Medical Center where they warned my parents of potential cancer-causing internal gonads, but they were called potentially cancer-causing simply because they were non-functioning in what they expected to see and what they would expect to see in a typical testes or ovary set. In the early 2000s, I began kind of early prepubescent hormone replacement therapy. And this was after a lifetime of being told that I was saved from cancer, urological scary vagina cancer, when I was a baby. And that's what all the scars are from. And I was told by many endocrinologists and therapists, an entire healthcare team actually, that because I was deficient in certain ways that I would need to take these supplementary hormones. And those were the conversations that were involved after I was of an age to consent or an age to be informed and have awareness and have a speaking part in my own healthcare. And so that's what I was told to acquiesce to the early hormone replacement therapy. And in 2006, before I graduated high school, I was coerced into a second plastic surgery, again, just for the sake of cosmetic heteronormativity. And, for sexual expression that I would later enjoy as an adult. And it was another 9 years after that before I learned of my intersex identity and the truths of what had happened all the way back in Connecticut and Duke, and then began participating in healthcare and visibility movements for intersex awareness and rights. That's when I moved out here to the West Coast and began doing slam poetry, talking about all my rage and all these things in a very artistic sense. And, speaking in metaphors was emotionally satisfying, but it didn't change the world the way I wanted it to. So that's why I'm super here to be speaking literally and clinically and talking to people who want to see legal action and see traction made, not just in societies and people's minds and hearts, but also in practices. So this is a generic roadmap of being born intersex. Intersex people are born with genetic or bodily variations that hold indeterminate sexual classification values. And so we're thinking about values in a dichotomous, dimorphous sense. Are you going to say X or Y, yes or no. And so without the classification value, it's indeterminate. And this is a problem because indeterminate sexual classification leaves someone's reproductive roles in their family or society undefined. And this is psychologically damaging for the parents. And it's also against heteronorms in society, which I'll talk about a little bit more. So non-standard deviants, which are intersex, but they include other people who might not identify as intersex. Maybe people who are disabled, if we have an intellectually disabled person, or if we have somebody who's born with other congenital, conditions. It could even be race-related. It could even be like immigrant-related. People who are non-standard to the normative dominant culture are treated to interventions, especially as infants. So otherwise known by names of very specific diagnosis, usually named after the doctor who discovered the specific quality of genes that resulted in the intersex classification. Intersex is just an umbrella term for people whose sexual anatomy and genetics are natural variations of human shapes and reproductive functions. Just like any other natural variation in a diverse human species, intersex people are here, we've been here, and are gonna be here for a long time. And we're here to talk about why is this community of people being erased surgically? And it's not because we're unhealthy. So the reasons I've listed are and this has been in my experience, again, I was assigned female and reared as female in a very gender traditional culture and setting in rural North Carolina. So there were extreme differences between how my brothers were treated growing up and how I was treated. And that's the same at school, and leaving aside the point that I am a queer woman, but growing up in the rural South, women and men are treated very, very differently. And so that was obvious to me for a very, very long time. Even before gender movements and non-binary discussions came out, there's cultural expectations that were being reinforced through this surgery and through the prognosis that the doctors gave to my parents and my family to keep the surgeries a secret from me so that I wouldn't be confused and I wouldn't stray from the feminization and grooming efforts that they had invested into my childhood. And so sexual colonization and Money's precedent. Dr. John Money is a doctor, quote unquote, from who emigrated from New Zealand in the 40s, and in the 60s at Johns Hopkins University, a research hospital, performed some extremely unethical experiments on a set of twin siblings, a baby boy and his brother who was damaged during circumcision. And rather than repair circumcision injuries, the parents were convinced to completely remove the sex organ of the injured child and allow their child to undergo a sex change at Dr. Money's convincing. And so that's basically what happens to intersex children given sex changes, at least to women, people who are assigned women. And again, this radical decision and this radical snatching of choice in people's skin and organs really speaks to the institutional ownership that doctors and surgeons and hospitals feel entitled to, and when it comes to infants especially. I think there has been some discussion about, power dynamics and things like that in our country and how it relates to circumcision and religion and all of this. I don't think it has very much to do with any of that. I think it has everything to do with the source of power and control and who's not that person. And so when we live in a pyramid system, everyone who's not at the top of the pyramid suffers. And so when we're talking about circumcision, when we're talking about intersex genital mutilation or female genital mutilation, it's really how well do you obey orders? How well are you going to assimilate and do what we tell you to do in heteronormativity? And so that's what happens for intersex people I don't know. I haven't been circumcised in the penile sense, but if you guys feel the same way, you can let me know later. And then lastly, the reasons that intersex people specifically are targeted in this way and also created exceptions for, as Tim mentioned earlier, in all of the anti-trans bills, 80% of them list specific exceptions for intersex infants. Say, we're going to perform sex changes on intersex infants even though we are saying sex changes for youth are illegal and immoral, because it's more important to pathologize and erase someone whose inclination might be towards queerness because they don't fit into heteronormative expectations than it is to allow someone to live with their own bodily autonomy. So yeah, I think to erase any inspiration that would encourage the development of non-heteronormative ideals or relationships or sexual expressions is the real goal of these types of surgeries. And so why do people say yes, though? We've got a whole industry of educated, expensive, educated doctors. And the parents of children who are bearing these infants out of love and making decisions, hopefully in their own best interest. Why do they say yes to these things? So this study here, which was brought out from the Brussels collaboration on bodily autonomy, I'll have a resource list at the end, pulled over 1,000 cases, and then for the report used 71 reports to just gauge the reasons why doctors recommended intervention and why parents said yes. And so this chart here is why doctors recommended. I'd say the number one reason is going to be urogenital plastic surgery or strictly just cosmetic. So those are the reasons why the doctors recommend it, and I will just note that parental outcomes or quality of life for the patient are literally never cited by these 71 doctors at least. So these at least 71 doctors never had a request from the parents to say like, oh, we're really concerned our kid is born intersex, can you do something about it? Never even entered their mind until a healthcare professional brought it up to them. Nor when the healthcare professional brought it up to them, did they have in mind, I'm really worried about your kid. Like, this kid's gonna suffer. That might have been what they said. But when the doctors reported their own notes internally, nobody spoke about creating quality of life for the children they were operating on. They were speaking on changing the urogenital structures, creating training and opportunities for surgeons and in industry. And they were also talking about cosmetics, appearances. So some of the health outcomes, I'm sure we can guess, and you don't have to, because there are thankfully now, since 2015, when I first discovered and came out as an intersex person, there's no data on intersex and intersex genital mutilations. Before that, the internet was even more of a dark forest, and trust me, as a young intersex tween, you would try and Google stuff, and it was not good Googling. And so having the lack of representation in society and the lack of definitive feedback from healthcare or home support systems really damages self-esteem and emotional response in building relationships with society, with individuals, with yourself. And so I'd say that like building trust and an expectation of generosity in other human beings is one of the most detrimental, damaging things that happened to me as an intersex person because of these surgeries and how my family treated me and kept me in the dark for 26 years. It's still hard to believe that other people aren't going to screw me over at some time or another just through sheer ineptitude, but that's okay. I'm from the East Coast. I can get away with being sassy. As with circumcision and FGM, multiple surgeries, urogenital surgeries, are going to impact people's sex life. And so it's going to impact people's sexual sensations and continence levels, tissues, all of it. Especially mobility. You know, I'd say like stretching and like all of these things is kind of its own journey every single time you want to develop a new relationship with a partner. So health and wellness in sex is definitely impacted. And then lastly is going to be hormonal management and physical therapy. Each 18 months, I was thrown into early menopause. I've never had any sort of natural hormone growth or production in my body at all that wasn't synthetic and delivered by an endocrinologist with approval. And a lot of the times prior approval and double-checked approval, because it's like, oh, make sure she's not being trans. And so that's been really hard to manage, especially as with an upset family that is, again, part of the lower middle class of America. We moved a lot. We had to, just for salary reasons, financial reasons. And then as I moved and left home, it just became an absolute nothing. It was not at the top of my list. Like, go find an endocrinologist while you're in culinary school and then figure that out. It's a lot of work to keep up with the continuing health care. And when you have been given this disability and given this, this leverage to be held against you for the sake of health your entire life. And so that is the hardest part, to be perfectly honest. It's just like managing a balanced level of health and staying healthy without letting it get me down, because it's always a battle and there's always gatekeepers in the healthcare system. We need to uplift intersex, which I see people in this room are already doing, and I'm so happy and I'm so pleased. And one of the reasons I just kept my mouth shut when people were asking about questions is because I felt so confident in the people in the room. And that's like kind of one of the first times since I came out as an intersex person and started working as an advocate and a public speaker that's ever happened. I'm normally the first one to be like, actually intersex, blah, blah, blah. But I was like, there's plenty of people here, like they got this. And that's a big step for me. So I appreciate that this room, at least, has made a huge important step for society and is ready and willing to start mirroring that. So we can give ourselves huge clap. That's straight up open-mindedness right there. And then, yeah, going back to the eugenics healthcare, you know, Kellogg's was one of the guys who practiced eugenics and said sex is gross. And this is where they were all in the same medical journals together, him and Dr. Money, and, you know, all of these terrible experimental scientists. I don't want to call them doctors, because doctors are people who heal you. And so these guys are like mad scientists. And so we're standardizing these crazy mad loons at the helm of our health. And that's not what should be normalized. That's not what should be standard. At-risk populations for forced intervention include individuals covered by the ADA, the LGBTQI+ community, women, men, children, gender diverse, and institutional wards of state, meaning people who are incarcerated, foster children. Some of the biggest and most famous cases in IGM have involved youth who are being transferred through foster care in between states. And I think one notorious case involved a young African-American infant in South Carolina, MC, who had such little oversight over his health care that the surgeons and the nurses and everybody at this research hospital who was pressuring was it DHS? I forget what it's called. But the foster system pressuring the workers, there was a different worker who brought the child to his medical appointments every single time. And so nobody had a continuing train of communication. Nobody had a chain of like accountability over this kid. And so poor guy just had the entire surgical team run amok. And after MC was finally adopted, I think there was a big settlement. I need to follow up on that and see where it went. But this was back in 2006 that all this happened, and things were still going on in 2014, 15 when I was getting active in the intersex community. And so finally, families living at or below poverty. And I don't know how that statistic will change with changes to Medicaid and government insurance, but I think echoing what a lot of other speakers here have said today is that the access to IgM surgeries through Medicaid and federal health insurance has been one of the things that's pushed it a lot. That was one of the things that pushed my parents and the surgical team to coerce me into, final surgery and treatments before I turned 18. It's because there is like this big thing. And all of this, it doesn't create good, positive health outcomes. It's created, more of a health burden for me to take care of, more disabilities than it actually solves. And so it creates dysfunction and over-reliance on a costly and ineffective medical system that we have given control over our healthcare system to. Outdated bunk science, Kellogg and money still influencing people. And we still quote Freud in pop science and anecdotally and stuff like this, but I think there's a lot of evidence that goes against what we all knew in the 60s. Smoking cigarettes being one of them, So there's medical science changes all the time, and I feel like continuing to argue that there is a benefit to circumcision, there is a benefit to IgM, is a lot like saying there's a benefit to smoking, which there might be, but just for you. if you are building that much cognitive dissonance, you must deserve that. And then, lastly, it stagnates and stigmatizes efforts to create further understanding of non-traditional values and strategies in a changing world. And what I mean by that is not only embracing the potential for individuals to just be queer or just be alive, without having to subscribe to a system of heteronormativity. I'm also looking at our culture, our medical system, our way of understanding health and interaction with our environment, and being able to accept influences from other cultures and histories that aren't white European and scientifically, industrially based. Because history has shown us that there are other cultures out there that have space and have ways of expression and have ways of understanding non-binary bodies and non-binary sexual expressions. And they've been around for a long, long time. And that's what's missing in our industrialized society. We're dimorphic by nature because that's how weighted production lines work. You have one in and you have one out. What else do you need? It's a lot, apparently. We're doing really good as far as getting the word out there. Less and less people are asking, what's intersex and what do you mean? And more people are asking, okay, how can we help? What do intersex people ask for as a community? And once again, I just want to laud everybody in this room for being a part of this project, because what we don't need is pats on the back or sympathy or extra trauma to deal with from people's curiosity about something that's not talked about. What we need is just, legal action. And so recognition, and having our humanity accepted and celebrated, so that families who are middle class educated like my parents were will have less of a chance of being pressured by really inappropriate and unethical surgeons and healthcare teams who don't have integrity. I'll just say that. I would love to say that every person who has an extreme and expensive education like a doctor does should be a good person, but that's not how this world works. People know what they're doing is wrong all the time. And just like smoking cigarettes, you can build cognitive dissonance for yourself and find a way around what you know is wrong. And so, countries that have introduced legislation that partially or completely acknowledge intersex rights, Kenya, South Africa, Chile, Colombia, India, Israel, Albania, Andorra, Bosnia and Herzegovina, France, Germany, Greece, Iceland, Malta, Netherlands, Portugal, Serbia, Spain, and Australia. And by partially or completely acknowledge, we're not looking at necessarily legal protections. We are looking at acknowledgments of human rights, and we're looking at acknowledgments of human rights abuses, such as what's been, issued by the World Health Organization, and other, United Nations and stuff like this. So there's a lot of people from a lot of different walks of life here, with doctors and lawyers and bakers and candlestick makers. And, intersex people are everywhere. We're very intersectional. And how do you approach an intersex person if you are a parent and you have an intersex child? If you are a business owner or an employer and you have an intersex employee? I think number one is to understand that what we talked about earlier, there's hundreds, if not, more, different ways of being born with genetic diversity that could result in an intersex variation physically. So it's kind of a concept, and it's a concept that I started embracing at first. When I first came out about my intersex identity, I was very protective of it. It was brand new to me. It was very vulnerable. And I was like, that's actually not intersex. And now I'm just like, yeah, you're intersex too. Everyone's intersex. It's totally fine. And it's true, because at the end of the day, I remember in 6th grade biology class, I learned that the Y chromosome is just a mutated X chromosome. And if my sexual response gene is a mutation, and so is yours. So my opinion is that a lot more people are intersex that we're not aware of. And maybe that's one conceptual leap that we can make as a society. I am not a huge proponent of, adding third gender categories or extra gender categories. I'm a bigger proponent of saying, like, you don't need that category unless it's special for you and your culture. Kind of like what we're talking about with secular circumcision. Like, you don't really need that surgery unless it's a special rite, unless it's a special rite of passage for you to have that identity. Scientifically and legally, we don't need genders. We could go perfectly fine with just being numbers, which the government sees us as anyway, because that's how we pay taxes. So there's people's specific experiences to intersex. One of the ways that you should approach intersex is approaching somebody with a trauma-informed manner. A lot of people might not identify as intersex. They might identify as having such and such variation, or otherwise what's known as a disorder or a difference of sexual development. Other people might have, just different ways of approaching the topic and might not want to talk about it at all, because you have to remember that not only is trust severed with the concept of health, and doctors and support, but also your family in a lot of cases. And so there's a lot of trauma to go through when you're trying to figure out more, and sometimes less is more when you're communicating with somebody about a new topic. So I'd say support autonomy non-judgmentally and just ride the wave. And I wrote down here, between sexes here, you can read it like it is, between sexes, between male and female. And for some people, developmentally, that is what intersex is. But I am actually writing this and reading this as like between jobs. Someone who is maybe left their job or taking a break from working right now doesn't really want to be asked, like, so where are you working these days? You know what I mean? And it's just like that with kind of intersex people. It's like, so what's your opinion on gender? What's, all of this? And it's like, I'd rather not talk about it. I'd rather sit by the pool and have a Mai Tai between sexes right now. And lastly, it's a physical variation. So it means being born without biological structures or genetics that typically define male or female in our culture due to genetic diversity. And specifically, we're talking about like reproductive structures, but I think, again, with the open concept we're embracing here, it's more than just anybody at this point. There's a lot of mental health or physical disability related needs that come along with being intersex. That can be as a result of intersex surgery, or it can be as a result of something completely separate. but just like any other, disability that we want to respect. We're going to refer to lived experiences and finding voices that can present intersex experiences authentically and without institutional bias. And that's going to build stronger movements centering consent, respect, and collaboration. Yeah, thank you to Eric once again for including intersex people on the litigation that you're pushing forward in Oregon. Yeah, it's huge. We're here for it. We're here for it because policy reform, there's a lot more that joins us and a lot more that we're similar to each other than what separates us, even sexually and gender. And then lastly, having an open and responsive intellect, challenging mainstream viewpoints and investigating competing interests, personal biases, and also engaging with fact-finding and verifying information on your own and not just going off of conversations that you're having, even with one intersex person. One intersex person doesn't know it all. I definitely don't. Aliana knows. Some resources besides the Genital Autonomy Collective here in Portland. I found a lot of helpful resources on the Interact website. There are things like what we wish our doctors knew, what we wish our therapists knew, what we wish our family knew. Here's a brochure for intersex people in the workplace and how to create accommodations. Here's all of these definitions and glossaries of terms. It's super duper helpful for like 101 basic knowledge. And they've also got pages and pages of intersex litigation history where you can look and see what the landmark cases have been over the years. The ILGA, I appreciate the information and the support and platforming that this website and organization has given to the intersex movement. It's just important to have global and across the aisle politics involved in any long-lasting movement. And then the Houston Intersex Society, if you can look them up on Facebook or Instagram or any other social, I'd super recommend them. They're just some of my favorite people in the world. They're still hanging strong with like the theater, performance, community-based outreach methods. Very, very art-driven, very expression-driven, and diversity-led group as well. So 100% recommend talking to people with not only direct experiences, having grown up intersex, but also who have diverse experiences in gender, experiencing race in America, experiencing immigration, like all of these things that are going to help open up your eyes. So the conclusion is that the impact of IGM and other forms of genital cutting isn't just proven through like poor health outcomes in one individual. It's not a case-by-case thing. Human rights abuses in this context are really a collective abuse. We were talking about this before, epigenetic trauma. And it is a collective trauma that we all actively engage in. And it's because there hasn't been interruption. There hasn't been the hiccup, the catch yet, where somebody stumbles or the machine like has a flat tire, essentially. So that's what we're working on here. We want to be the one that throws the gravel into the machine, and then all of a sudden stops working and it all breaks down. So yeah, I'm very excited to be here and to be a part of this movement and to contribute what I can. Thank you.
Well, thank you.
Yeah.